Hi, I'm Dr. Charles Denham. Today's briefing is on a topic that we think might be important to you.
We wanted to have 2 children because we wanted them to have each other. And now Matthew's an only child.
Many stories have captured the headlines. However, the story of 2 best friends in high school dying the same night in a typical middle-class community drives home the impact on our nation's families. The CDC announcement in August of 2018 regarding the growth in opioid overdose deaths in 2017 confirmed the exploding crisis that is showing no end in sight. It is one of the leading causes of preventable death that bystanders with very little training can address and save lives in those precious minutes before professional first responders arrive. The CDC has documented that more than 68,000 Americans died of drug overdoses in 2018. The 2018 death count for all 50 states and the District of Columbia represents a 2-fold increase over a decade. Opioids, which include prescription painkillers along with heroin and other illegal synthetic opioid drugs, contributed to more than 48,000 of those deaths. These include both accidental and intentional overdoses. Lauren Rawson, co-author of the report and statistician at the CDC's National Center for Health Statistics, is quoted on CNN as stating, "The most striking patterns at the national level are the recent increases in the numbers of drug overdose deaths involving synthetic opioids, excluding methadone." The CDC has described 3 waves of the epidemic of opioid overdose deaths. The first wave was the rise in prescription opioid deaths. The second wave was the rise in heroin overdose deaths. And the third wave has been the rise in synthetic opioid overdose deaths. Oral prescription opioids have been confirmed as the gateway to heroin and synthetic opioids by many academic and industry experts. Those addicted to opioid painkillers are 40 times more likely to become addicted to heroin, much higher than those who are addicted to alcohol, marijuana, or even cocaine. 3 out of 4 people get such opioids from a family member or friend, which is a very hard adoption route to address. Once the money runs out to buy such oral medications on the street or they are unavailable from other sources, people who would never consider using heroin are driven to it by their addiction and the low-cost availability. The CDC found that 31,900 overdose deaths were related to fentanyl and other synthetic opioids in 2018, which is 22 times the number due to these drugs in 2002. The extremely high potency of fentanyl and the synthetic opioid carfentanil used by veterinarians for very large animals such as elephants stems from the extraordinary impact that very small volumes can have. The volume of a lethal dose of these substances is very small. Fentanyl can be 100 times the potency of morphine, and carfentanil can be 10,000 times the potency of morphine. These substances lead to a staggering growth in opioid-related deaths. Study of the 2002 Moscow theater hostage crisis by British Defense Laboratories found the evidence of carfentanil and remifentanil in the clothing and urine from British survivors. The team concluded that an aerosol mist of carfentanil and remifentanil was used to subdue the Chechen hostage takers. Drug dealers are likely very unqualified to work with these synthetic opioids that are truly hazardous materials. Driven by the greed to maximize their profit from their street product, they mix them with heroin and risk lethal dosages. There are more and more news stories regarding the threat of synthetic opioids, putting professional first responders as well as bystanders at risk, thus creating the need for naloxone as a reversal agent to rescue them. Anyone near a crime scene or caring for an overdose victim may inhale these substances. Some believe they may even have a life-threatening absorption through the skin. The Justice Department announced the release of a new fentanyl safety video for first responders in September of 2018. It's entitled Fentanyl: The Real Deal. The goal was to address the risk to first responders and reintroduce the guidelines that were released in 2017.
What we've seen in the last few years with fentanyl is a rise in the number of deaths associated with its use.
First responders are increasingly likely to encounter fentanyl in the line of duty. We want to make sure that they have the facts to keep them safe.
I got this on my hands.
The video highlights protective actions first responders should take to perform their daily activities safely when the presence of fentanyl is suspected, actions to take when exposure occurs, and steps to take when individuals exhibit signs of opioid intoxication.
If you think you've been exposed to a substance that could be fentanyl, you want to take that very seriously. You want to alert a supervisor or a buddy, tell them what you think is going on, and the first step is to prevent any further contamination. The second step is to not touch your eyes, your nose, your mouth. That way you'll prevent further exposure. Third step is to simply wash the area with soap and water. And then finally, if you think your clothes or some of your protective materials have been exposed or contaminated, you want to remove those through your standard decontamination protocols. The threat of fentanyl is real, but we're showing a multi-layered defense that will keep first responders safe while they do their job and keep the rest of us safe.
The video provides scientific and evidence-based recommendations to protect against exposure to fentanyl. It will be an essential training tool for first responders as they continue their fight on the front lines of their battle against the opioid crisis. Overdose deaths occur when the opioids suppress the automatic drive to breathe, and victims die of oxygen starvation of their vital organs. The more potent the opioid, the more likely this will happen. The heart continues to beat until it can no longer live without vital oxygen. Naloxone, also sold under the name Narcan, competes with the opioids for the target receptors in the body and can revive a patient within seconds to minutes. The CDC has historically described a three-part strategy to reduce the heroin epidemic. First, to prevent people from starting heroin by reducing prescription opioid painkiller abuse. Second, to reduce heroin addiction by ensuring access to medication-assisted treatment, which combines medications with counseling and behavioral therapies. And third, by expanding the use of naloxone as an opioid reversal agent that can save the life of overdose victims. The World Health Organization, in its key facts about opioids, affirms the existence of a global crisis in which 70% of drug users will have witnessed a drug overdose death. It also cites naloxone as a reversal agent that can prevent these deaths. My recommendations to any organization or individual is to be prepared to know what to do when an opioid overdose occurs. When our leaders of the MedTech Bystander Care Certificate Program identified the leading causes of death for which bystander care training could be developed, care of opioid overdoses was high on the list. MedTech leverages 4 strategies: developing and sharing the latest bystander care methods, teaching through blended online and on-site learning, using immersive simulation methods for deliberate practice, and going to scale through local teams and networks. I will close with a few highlights of the knowledge and skills that we have learned are important. The following is not a complete or thorough review, and I recommend you take a full course from credentialed experts in your community. The first fundamental concept that is taught is that scene safety is job one, making sure that the bystanders and the victim are not at risk of further harm from exposure to opioids or another threat such as vehicular traffic due to the victim's location. Second is how to make an effective emergency 911 call or have another bystander do it for you to report the address, situation, remain on the line, and help professional first responders to your location. It's important to understand that any substances near or on the victim may be a threat to you and other bystanders throughout the entire episode of care. Personal protection equipment such as gloves, masks, and glasses are as critically important when caring for a potential opioid overdose victim as they are when caring for someone who's bleeding. This should be available to any bystander or professional first responder who will care for an overdose victim. It's increasingly important to have Narcan available and accessible to bystanders in organizations and make sure staff understand how to administer it to a victim, and to understand how to help keep a victim in a position to maintain their airway and keep them comfortable while waiting for professional first responders. The recovery position is a body position that allows an unconscious victim to maintain an open airway and allow fluid such as vomit to drain out of the body rather than into the airway. The American Heart Association, American Red Cross, and Community Emergency Response Team programs provide opportunities to get this kind of proper training. Although many states have passed legislation to make Narcan available to organizations and individuals, in our experience, many of the community pharmacies are not yet prepared and may be unlikely to work with businesses who want to have naloxone available. The best approach a company, a faith-based organization, or another member organization can take is to work with a licensed medical practitioner to help coordinate how to obtain naloxone, learn how to use it, and be ready to care for an opioid overdose victim. The probability we may encounter someone experiencing an opioid overdose is now so great that it is incumbent on all of us to understand the threats and the safest and best bystander care possible. The person you save may be someone you know or even someone you love.